Good afternoon, everyone. My name is Jan. I'm a first-year nursing student. And here with me, I have my fellow navigators who helped put together this presentation. They're going to introduce themselves.
Hi guys, my name is Kristine from Guerrero. This is my last year as a pre-nursing major.
Hi guys, my name is Patsy and I am also a first-year nursing student.
All right, and today we're going to be presenting on how to become a nurse, a beginner's guide. This presentation is part of Project PROA STEM and Career Exploration Series.
We'll go.
All right, so this is just a disclaimer. Any information that we present is research conducted by us, the presenters. We encourage everyone to participate in this discussion and to do your own research as well to be informed. All right, so just some housekeeping rules. Please be respectful, listen attentively, please participate. And for everyone on Zoom, mute your mic when you're not speaking. Feel free to type any questions or comments in the chat, and please remove any distractions from your surroundings if your camera's on. All right, so this is what we're going to be talking about today. First, we're going to talk about what is nursing. That includes the role of nurses, the importance of nurses, and nursing career options. And then we're going to talk about the nursing program, which includes the pre-nursing part of the nursing program, the program requirements, and the NMC Nursing Club. Then we're going to talk about financial aid opportunities and specifically the nursing school scholarship. And then finally, we'll have an activity and there might be a prize. All right, so I'm going to hand it off to Kristine and she's going to present her part.
Okay guys, so before we dive into how to become a nurse, I think it's only right if we do know the definition of nursing. So what is nursing? So nursing is a profession that is both an art and science because it uses specialized knowledge and certain creative skills to provide care and promote wellness to individuals. Now, there are two essential elements into becoming a nurse: knowledge and application of knowledge that you will learn in the program. Nurses are the epitome of critical thinkers, and this is because they are constantly thinking on their feet in order to make the best judgments for the patient and provide the perfect care. Now, the roles of nurses may vary depending on the workplace of the nurse, but some of the basic roles include first to detect health emergencies and work on the front lines of disease prevention. A great example, COVID-19. They are also deliverers of primary health care, including promotion, prevention, treatment, and rehabilitation. Nurses are also consistently monitoring a patient's health the day they go in the facility, the day they go out. So they chart everything from vitals, medications, the procedures you've taken, or even any pain you've been experiencing. Now, with this information, they communicate and work with other healthcare professionals in order to provide the perfect treatment. Now, the importance of nurses is very critical in the healthcare industry. So in many countries, nurses make up half of all healthcare professionals and are considered the backbone of the US healthcare industry. And this is because nurses spend more time with patients than any other health professional. Now, a lot of you are probably thinking it'll be the doctor, but doctors are generally assisting other patients throughout the facility. And as we mentioned in the slide before, nurses are monitoring a patient's health the day you go in, the day you go out. So it is very crucial and important to spend time with the patient in order to record this information. Now, nurses are also informers on healthcare literacy. And a lot of you are probably wondering, what is healthcare literacy? Healthcare literacy is one's ability to understand basic health information to make informed decisions. A very persistent issue plaguing the US healthcare industry is poor healthcare literacy. Now, some examples of poor healthcare literacy include not understanding how the bodies work, not understanding the purpose of a medicine, maybe not even knowing how to fill out a health application form. Now, some influencing factors include living in poverty, your education, your race, ethnicity, and your age. Now, nurses devote a lot of time and energy into educating patients. Like we mentioned before, doctors are assisting different patients throughout the hospital. So nurses do take the time to inform the patients. For example, the medication they're taking, what's expected from that medication, the adverse effects or the side effects. For example, also how clinic operates, or yeah.
Okay, so now that we know what a nurse is, right? Why do we think you should pursue a nursing career? So here are just a few things. Nurses make a real difference in saving lives every day. And I'm going to tell you right now that the most inspirational feeling is walking to a patient's room and walking out, knowing that you played a role, you played a part in saving their life. It's a truly rewarding feeling. And I've been at the hospital and I can tell you now, it is a rewarding feeling, right? So nursing is a well-respected field, right? So imagine you walk around and like, you know, you can tell other people I'm a nurse, and your parents can probably be like, "Wait, my son's a nurse, my daughter's a nurse." You know, it's a well-respected field, and many people will be able to acknowledge that you took the time to get all that education, and you will earn that respect. So there are many different career paths to being a nurse, and we'll get more into that later, right? You can choose your own specialty and do what you love. So nursing is a very, very versatile profession. You can go anywhere and you're gonna be able to find a job. Not only that, but within that job, you're gonna have many specialties that you can choose from as a nurse. Nurses gain a competitive salary. Okay, so I know most of you do want that competitive salary. I'm going to tell you now that nursing pays. Nursing pays, right? Nurses can enter the workforce relatively quickly. So, like I said, nursing is a really versatile profession, but it is also a profession that is in high demand right now. So, as soon as you're done with your degree and you get your license, you will find a job very quickly because in high demand. And also there are many financial aid opportunities for nursing students. We'll get more into that later, but yes, there's a lot of financial aid, and it goes back to it. They're in high demand, we need more nurses, right? Nurses never stop learning. Every new challenge translates to a new learning experience about people, cultures, diseases, and treatments in their everyday work. So not only are you going to be a nurse providing care to patients, but you also earn from it. You learn from being a nurse, you learn about people, you learn about diseases, and you learn about other cultures, right? So the nursing profession boasts a high level of job satisfaction. Like I said, it's very, very inspirational when you know in your heart and in your mind that you played a part in saving someone's life, right? And finally, nurses care. So we're at the bedside every day with patients, and we are able to see everything that goes on in the hospital. Like, I'm not saying anything about the medical profession, but doctors only see the symptoms and the charts, and they make a decision based on that. But we are able to talk to the patient at the bedside and make decisions based on what care is best for them. So we as nurses care. All right, so now I'm going to hand it off to Patsy. She's going to present her report.
Okay, guys. Oh. Okay, guys. So now we're going to be talking about NMC's nursing program. So the nursing department offers an Associates of Science in Nursing, and the purpose of this program is to advocate for locally educated and licensed nurses to work in a variety of healthcare provider agencies here in the CNMI and the Pacific region. So if a student wants to enter the nursing program, you need to go through the pre-nursing level. So the pre-nursing level consists of you completing all the core courses and general education requirements with a C grade or higher, and then you have to earn a GPA of 2.5 or higher, and that GPA must be maintained throughout the program. So what are the program requirements? So like I said before, your prerequisites need to be completed with a C grade or higher. Any courses that aren't completed with a C grade needs to be retaken. And then you need to maintain that GPA of 2.5 or higher. After you've done that, you need to submit your application. So the application is usually updated on the NMC website under nursing. And usually they would send out a reminder saying, hey, the application is on the NMC website as well as the due date. So after you turn in your application, you need to start preparing for the entrance exam. So the nursing program entrance exam is something that is an exam that the nursing program put in place so that they know that the students coming into the program are prepared for their courses. The criteria for passing the nursing program admissions test involve using a 2-tier analysis based on 5 test content areas, which are on reading, writing, math, science, and critical thinking. So to pass with tier 1, you would need a score of 60% or higher in all 5 content areas. And then for tier 2, you would need to pass with a score of 60% or higher in 4 content areas, and then a score ranging from 50 to 59 in 1 test content area. So unfortunately, when a student does not pass the entrance exam, they would need to wait to retake it the next fall semester. Okay, so when you take the entrance exam, you aren't immediately into the program. You would have to pass the class size. So if there's more than 30 students in the program, you would be waitlisted. So we want to talk about the financial aid for nursing students. So as my first year in nursing school, the nursing program, we spend a lot of money on textbooks, school supplies, like your stethoscope, BP cuff, your uniform, and it's a lot of gas coming to school every day. We have class from Monday to Saturday, and we also go to the hospital on Tuesdays, which is at a later time. But so the nursing school scholarship was established by the CNMI Scholarship Office, and they wanted to promote the profession to encourage our residents to pursue a nursing career. So the scholarship is used to pay directly for students' educational needs, such as tuition, textbooks, school supplies, transportation, and housing. It is a $8,000 per annum scholarship that will be awarded to 20 qualified students for the period not to exceed 2 years. So the 20 new slots are available annually beginning spring 2019 and it ends fall 2023.
All right, so now we're going to talk about the career pathways for nurses, right? So here are just a few nursing pathways that you can take after completing an associate's degree, but I want to highlight some, most especially the medical surgical nurse, the informatics nurse, the community health nurse, and the flight nurse. Okay, so does anyone know what a medical surgical nurse is? I expected that. Okay, so a medical surgical nurse, surprise, surprise, works in a medical surgical ward. And so what they do is they take care of patients that are pre-op, so they're about to go into surgery, and post-op, when they're after they come from surgery, right? So they monitor them, they monitor their status, they check if they're okay for the surgery, check how they're healing with the surgery, and discharge them once they're done, right? So then next is the informatics nurse. So this is a really good career opportunity for those that are into computer science, because in informatics, we take nursing and we add computer science and we bring it together, because informatics nurses deal a lot with electronic health records, and they deal really closely with the IT department of most facilities, and they monitor like the data, and with their nursing expertise, they're able to see weird data and give their professional opinion on what should be done with the data, right? And then there's the community health nurse, also known as the public health nurse. They work with public health departments, and they find resources in the community, find people who need those resources, and bring them together. That's what a community health nurse does. So for example, like they might find a person with needs that makes like a low income. They're gonna find a facility that provides services to those that need that, and they bring them together. And last is the flight nurse. It's something that I'm personally interested in. Does anyone here like to travel? Don't tell me you don't like to travel. Okay, so yes, a flight nurse, what they do is it's a really important job. They escort the patient to another facility. So what happens is, for example, a really good example is here on island. if you get a medical referral to go to another place and you need special monitoring by a nurse, that nurse will accompany you and escort you to the other facility, monitor your health, make sure you're doing okay. And once you get to that facility, there's this thing called endorsing. So what they do is they say, hey, this is our patient. Here's what we think is wrong with them. Here's all our data. We're relinquishing our care to you. So from one facility to another, they're the escort. All right. So how can you prepare for nursing courses? And I want to talk about my personal experience, and hopefully my personal experience will help you guys. I'll be honest, the nursing courses are pretty challenging. You're dealing with psychology, chemistry, biology, microbiology, all these tough science concepts, right? And truly the only way to handle all of this is going to be handled in the next slide. So it's time management, self-care, and good studying habits. So me personally, I like to use a planner for time management. I like to prepare ahead of time, and I like to stay organized, because if you're going to deal with the wealth of knowledge that you're going to be learning in the not only the pre-nursing program, but the nursing program itself, you're going to need to set aside time to study, set aside time to go to class. If you work, then you need to set aside time to go to work, self-care, and then you also need to set aside time for friends and family, right? So having that structure in your life is really, really important to manage your time. Now, self-care is important because in the nursing field, it's really prevalent. It's called burnout. And it's when you're so mentally exhausted from everything that you have to do, not only as a student from all the workload, but as a nurse from all the patients, all the workload, right? So the only way to handle that is, it goes back to time management. We have to set aside time not only for what we need to do, but also what we want to do. And that's in self-care, right? And good studying habits. What's the point of studying if you're not studying, if it's not going in your brain, right? So you really have to make sure, am I studying? When I'm studying, is it getting in the brain, right? And if it's not getting in the brain, then take a break, step away, and come back once you've taken that rest. So have those good studying habits. Time management, have that self-care, have those good studying habits. So the NMC Nursing Club. What is the purpose of the NMC Nursing Club? The purpose of this club is to encourage currently enrolled students to collaborate with each other and outside sources to promote health and wellness in Saipan, right? So if y'all didn't know, NMC has the NMC Nursing Club. And I think most students have this misconception that the nursing club is only for nursing students. That's completely false. Anyone that is currently an NMC student can apply to the nursing program. So as the VP of the nursing club, I can tell you right now that I highly, highly encourage anyone who wants to promote the health and wellness of the people of Saipan to join the nursing club, right? So if you want to apply to the nursing club, our applications are available at the nursing department in Building V or on the nursing club page on the NMC website. Last call, thank you. Thank you for listening to our presentation.